and it will be on the Wellness Everyday website for folks to see in the future. So we'll formally start the tape recording. Thank you. So again, my name's Dr. Jamie Rotnofsky. I'm really glad that you could all be here today. Our goal is to kind of give you an overview of what the Mental Health Service Act is, because we're aware that some folks have more knowledge about what MHSA is, and some folks might be joining for the first time. So we're going to give some brief background. And this is our agenda for today. So we did the welcome, going to go over the overview of what a MHSA is, and talk about the different programs within MHSA. We're going to talk about some updates, and then we will have questions and comments, and then next steps, some things that we'll be hearing about. Next slide, please. Thanks, Juan. So part of everyone being here today is because we all care about our community, and in our own ways trying to make differences, and we all bring unique experiences. And so we want to ensure that people are safe and feel comfortable sharing. So there's some basic guidelines to please not interrupt others when speaking, to please speak with a respectful tone, because words do matter. Everyone's voice matters, and allow time for others to share and ask questions. So the first component that we'll be sharing, we'll be going over the PowerPoint slides. If you have questions, please jot them down. And then at the latter part, we'll have at least 30 minutes typically to take questions and comments. And also know that if we don't have time to finish the questions and comments, people will be able to write in their questions and comments as well. But the plan is for us to be able to take those live. So that's the process for today. So we'll spend about the next maybe 40 minutes or so doing the presentation, and then take time for questions and comments. Thank you. Next slide. All right, I'm going to just talk about the overview of MHSA. We'll go to the next slide. So there's some general requirements. So MHSA obviously is regulated by the state. And so we have to follow a lot of guidelines and some principles that are really important. Part of that is community collaboration, which is part of what we're doing today, but also we'll talk a little bit about it later. We do these 3-year planning and needs assessments and community planning process. That will begin the summer of 2022. So you should be on the lookout for information about that. That's when we go out into the community. We'll be probably conducting some in-person community forums as well as on Zoom. We want to capture as much information as possible to get your input about the needs of our community. So community collaboration is essential and really important. So again, part of that we're doing today, and we hope you continue and spread the word about that. Also some standards and principles about cultural competence involving clients and family, as far as the voices of those that drive the services, that understand the services. It's also the focus about wellness and recovery, and it's a resiliency focused, a strength focused model, and integrated service experience for our clients and families. And we're going to talk about that later. Integration, it really goes beyond MHSA when we briefly talk about CalAIM. Also, again, the formal community planning process that will be happening in the summer. And part of what we're doing today, this is not part of the community planning process, but we want to ensure that you're updated about what's going on, as well as have an opportunity to get some feedback and questions from you. And then again, every year we produce an annual update. That's a conglomerate of information from all our providers, community-based organizations, as well as VCBH services, where we collect data. We have surveys, feedback, numbers, fiscal, all that is produced every year and put on the website. So you could actually look at every single program. Many of folks that talk today are in that annual update as they provide services to our community. And again, we mentioned the 3-year program and expenditure plan. So that community planning process begins summer 2022. But again, you could look, for instance, last year's annual report is on the website, and we'll look forward to producing a new annual update soon. Next slide, please. So there are various components of the Mental Health Service Act. So we're going to focus on 3 today, and I have my team here to talk about them. Prevention and early intervention, and we'll get more definitions of what that is. Community supports and services, and innovations. Those are 3 areas we're going to talk about today. The workforce development and the capital facilities and technology, the funding for that has sunsetted. So we'll be focusing on the areas that we have the main funding in, which is again, the PEI, CSS, and innovations. Next slide, please. The Mental Health Service Act in these 3 areas is funded a little differently, so hence the size differences. The main financial support goes to community support services, which is really for the folks that need the most intensive services, people that have serious mental illness, that need support, case management and such. And then the next pot of money, so to speak, goes to prevention, early intervention. And then there's a small amount of money that goes to innovations. Again, this is all based on state regulations about how things are funded. Next slide. So we're going to talk about prevention and early intervention. I'd like to introduce Greg to you, who's going to cover that area for us. Greg?
Thanks, Dr. Jamie. Again, my name is Greg Bergen. I'm on the MHSA team here at Ventura County Behavioral Health and primarily focused on prevention and early intervention programs, component of the MHSA Services Act. So I'd like to give an overview of the PEI component of the Mental Health Services Act, but the goal in not only giving you that overview of what the PEI components are all about, but to strive to communicate the regulations as outlined by the state governing bodies. So it's also important to note on the prevention and early intervention component that the regulations can overlap between components and that regulations come from the Act itself. Next slide, please. So the intent for PEI is to implement strategies to prevent mental illness from becoming severe and disabling, with an emphasis on improvement in timely access to services for underserved populations. So the strategies and activities are implemented early on to, 1, deter the onset of mental health conditions or relapse among individuals, and 2, to change community conditions that contribute to risk factors for developing behavioral or mental health issues. So as far as, I'd like to kind of bring out an example for the emphasis, which is improvement in timely access to services for underserved population. We have a program called Logrando Bienestar, and Logrando Bienestar helps youth and young adults in the Latino community to understand the importance of mental and emotional health, with the goal of helping individuals access services for productive and healthy lifestyles. So this program also includes Latino outreach. Next slide, please. Okay, so it also, it's important to note that it incorporates values of cultural competence, consumer and community empowerment, collaboration, and inclusion in providing services that emphasize recovery, wellness, and resilience. So the program strives to, 1, meet the priority needs identified by local, diverse community stakeholders, and 2, to meet the key community and priority population needs as outlined in the MHSA PEI guidelines. Now, an important note for Ventura County, our priority populations are defined as Hispanic/Latinx community, also, and that's English and Spanish speakers. So slide 3, please. Okay, I really like this slide. I want you to focus on the PEI goals internal here, in the blue box. This blue signifies that every PEI program should include these things. In other words, these are the commonalities of the PEI programs. 1 goal, prevent mental illness from becoming severe and disabling, and 2, to improve timely access for underserved populations. Now, the brown bubbles outside here, these are more specific, and this is where the programs get that specificity, because all the programs have at least one of these components in them. So each program will have one of these components. It's also important to note that the components are the same as some of the strategies, and also the same as some of the programs themselves. So it can get confusing that way. For instance, now the strategies below here, I'd like you to point this out as well. One, to provide access and linkage to treatment. Two, to improving timely access to services for underserved populations. We see that again, right? And three, non-stigmatizing and non-discriminatory. So when I bubble that down, and when I think of PEI programs, I like to think of these on the boxes on the right. So at the top, you see the positive outcomes. These are the positive outcomes we're trying to affect here. And two, below that are to reduce the negative outcomes from untreated mental illness. So I'm going to read these again. You'll see some of these themes here again. For positive outcomes, timely access to services for underserved populations. Two, access and linkage to treatment for people with a severe mental illness. Three, another positive outcome, we want to have a stigma and discrimination reduction. Three, or another point, suicide prevention. And the last one listed here, early intervention prevention, including relapse prevention. Now, the other thing it's important, and I like to think in my head, we're also reducing these negative outcomes from untreated mental illness, such as suicides, incarcerations, school failure or dropout, unemployment, prolonged suffering, homelessness, and removal of children from their homes. Another very important part of our PEI programs is every single one of them. Notice this bubble at the top here, access and linkage. Every PEI program we have, we focus on the access and linkage. We rolled out a new referral form to help with this process. It was pre-COVID. We continue to work with our providers on this, and we track those referrals that they make. Our new referral form is a new method that helps our providers follow the way they can make a successful referral. And so that's something that we work very closely with our providers with. Next slide, please. Okay, now this slide is showing who is available, that is, who has access to these types of services. So in other words, this shows who's eligible. So I'm going to read these real quickly. Universal services are targeted at an entire community and not identified on the basis of individual risk. And selective services provide strategies to deter the onset of mental illness among individuals and change community circumstances that contribute to behavioral health problems. And early intervention services are directed towards individuals exhibiting early signs of a mental illness or early onset of mental illness or emotional disturbance with psychotic features. And then I want to mention one thing that's very important for Ventura County, suicide prevention efforts. It's kind of interesting in the fact that suicide prevention is actually an optional component of PEI. However, especially for Ventura County, it's an important piece. And Dr. Jamie is going to be speaking to the various activities and efforts that are underway in Ventura County around our suicide prevention efforts. Next slide, please. Dr. Jamie.
Thank you. Let me just get the PowerPoint back up. Here we go. So we've been very involved. The Suicide Prevention Council is one of the subcomponents of the whole community that participates in this council. And by the way, if anyone would like to join, or just, you don't have to formally join, but just email us at MHSA@ventura.org, and we could give you the meeting notices and you're welcome to attend. What we do during this is we have various groups, peers, various organizations that we're all working together collaboratively to address suicide prevention. So that's the council. We meet every other month. And from that council, we also plan our yearly forum or conference. And we have subcommittees that do this work. Again, everyone's volunteers. We put together recently in September a suicide prevention forum, basically conversations about suicide. And we were very fortunate. We had really amazing speakers talk about their lived experience, different backgrounds, different experiences from a family perspective, from a person that is mental health or substance abuse issues. And we were able to not only put on this forum to have these conversations and for folks to share their experiences, the second part of the forum was to give an opportunity for folks to have smaller, more intimate meetings in these breakout rooms and having conversations. Again, this is all about decreasing stigma, increasing education, and it was tape recorded. So soon we will have that tape recording available for anyone. It'll be on a website. And also we'll be breaking it down to smaller segments too, because this can really be utilized for educational purposes. So I find that to be, I love when we could kind of put things together in a new way and continue to use this powerful information. So that is the Suicide Prevention Forum. Again, that's once a year. You're welcome to join the Suicide Prevention Council. Even if you want to attend one meeting, that's fine. And we'll also, for those that are working in the field of suicide prevention and the work that you do, we also encourage folks to come and present. We just started hosting two 15-minute presentations from our organization so we could all learn more about each other. So if you're interested in doing that, please just also email us. Also part of our prevention efforts is the funding of the crisis intervention training. It's called CIT. And this program is for training for first responders, police, sheriffs, dispatchers in understanding mental health, how to address issues in the community, because a lot of times the folks that are called is 911, and also to decrease stigma, to address folks that might have suicidal thoughts, how to de-escalate a situation versus escalate a situation. We know how important that training is. And so it's an integral part of our suicide prevention. So those are just some of the programs related to suicide prevention. And I know many of the work that you're all doing in your agencies also address this. And part of suicide prevention absolutely is prevention and wellness, right? And so a lot of programs that are funded through MHSA, that is the focus, so that folks have the coping skills they need, have the support they need, early identification of issues, decreasing stigma, making this, a conversation that we could have and talk about, and so that people are more likely to reach out for help. That's what it's about. So giving people the support they need and linking them to the services they might need earlier on. Okay, next slide. I'm going to talk about our community services and supports. This is known as CSS. This is the majority of funding that MHSA goes toward. So we're going to go to the next slide. So again, I do encourage folks that have the time and interest to look at the annual report. You can look at all the various services that are provided. There's at least 30 programs related to housing, transportation, addressing children and youth, transitional age youth, adult and older adults. So it really addresses all those age groups. And the programs and targets are basically children and youth who might have difficulty functioning, difficulty at school or at home or within the community. And of course, TAY, adults and older adults that may have serious mental illness, and providing the services they need to help them be supported and having the best quality of life possible, and accelerating some positive aspects for them with the supports that they need. And I'm going to talk a little bit more about that later, as CalAIM will hopefully also help bridging many more gaps, because we know there's gaps in the services. We know it's not a perfect service. We all need more. And hopefully CalAIM will really address those issues, those missing pieces of those integration and connections. Next slide. Okay, so CSS is about enhancing existing services, okay, improving the care for the crisis services, those that are most in need, linking folks to, after a serious crisis, to the services they need, and developing ongoing evaluation of the programs we have, but also what other systems might we need to enhance those services, increase those services, or develop new services. Housing, very important. Susan mentioned it earlier, part of MHSA funding is to support housing, to avoid folks from being homeless, and for folks that might be homeless to get them housing. For instance, we recently, some tax breaks that were provided for some housing units were going away, and so some funding was going away. We potentially could have lost some of our units, and so MHSA was able to fund that so that we didn't lose any housing. And in fact, we were able to increase, we had an opportunity to have another 1-bedroom apartment available. So housing is very important to have people have the support they need. It's very hard if people don't have stable housing. And of course, improving and expanding our wraparound services to children, a very vulnerable population, especially with COVID and the impacts of that we don't even fully know yet, but we know that we need to have more services because children are very much affected by that. Next slide, please. So the different categories of community support services includes full service partnerships, that's known as FSP. And again, the target for that is for folks that are the most vulnerable, that need the most intensive services, that they're provided very comprehensive integrated services so that all their needs are met. So that could be intensive case management, providing services within the community, because some folks have difficulty maybe getting to a clinic, as an example. They may be receive services from a psychiatrist, a nurse, a peer, again, 2-3 times a week. So whatever they need, those folks are need the services and supports. And so it's the most comprehensive, I would say, of the services provided. So the goal is if we provide integrative services, folks are less likely to be in crisis and need hospitalization, and also to get what they need to have positive lives and feel good about what they could accomplish. But again, they need that support, and so we want to make sure it's there. Outreach and engagement. So reaching audiences that may be unserved or underserved, making sure folks know about the services that are available. And then the other area, general system support, again, to improve the mental health services that are provided, such as crisis services, stabilization, wellness centers, peer support, case management, family education and support, and again, housing, which we talked about earlier. Next slide, please. Okay, I'd like to now introduce Hillary, who's going to talk about innovations. Hillary?
Thank you. Next slide, please. All right, so innovation is the smallest percentage of the MHSA allocation that we get each year. It's just 5%. And the point of innovation is to try to find new or creative ways to enhance the mental health services field or treatment. Each one of our innovation programs has to have a primary purpose. And so the state defines these, they're directly out of the regulations, and they include increased access. I think you're sensing a theme here, right? All of the components have the goal of increasing access to underserved groups, to increase the quality of services, including better outcomes, promote interagency collaboration, and to increase access to mental health services, including permanent supportive housing. So that permanent supportive housing piece is one of the latest changes to the regs there that got included. Next slide. That's it for that one. These are the list of projects that are coming up and the ones that are concluding. Our future projects for this year that we're trying to get approved is a third sector FSP expansion. That's expansion of work that's taking place with the multi-county FSP project, a senior homelessness prevention program, and mentorship and mental health for first responders. So you will probably be hearing or seeing those projects go up on our website before June, and the third sector project extension is actually posted right now. If you'd like to make a comment or review the proposal, it's posted there at vcbh.org. Next year, we'll be seeking innovation submissions again. That's how we get the majority of our innovation projects. That's on wellnesseveryday.org. It's live 365 days a year. So if you ever have an idea or you ever have an agency that you think maybe should submit an innovation idea, that's the place to do it. Those get collected and reviewed every time we kind of move through our list of eligible programs. The only time that we kind of go outside of that is if we do have the opportunity to participate in a multi-county project, and those come from the state. For example, the multi-county FSP project. There's also one on early intervention for early psychosis that we just kind of found out about recently. But otherwise, we get all the ideas from the community and develop those alongside our partners, our community partners. Projects that are ending, this year we concluded the Bartenders as Gatekeepers program, the Push Tech program, and Healing the Soul. And those final reports are all due next month in December. And so their interim reports are again all posted on the Wellness Everyday Innovation page. And their final reports will be posted there as well. And that kind of gives you all of the findings from what the project learned, the good, the bad, and the lessons learned. Next year will be the final year of our FSP data exchange, which is where we're integrating a couple different data systems. And the following year after that is when we're projected to close the multi-county FSP project and the Conocimiento Youth Project, which is addressing ACEs through core competencies. Next slide. And I'll turn it back over to Dr. Jamie.
Thank you. Okay. Again, I have mentioned this earlier about the 3-year annual update. So the annual update that's now posted, the 3-year one, is almost coming to a conclusion as, again, we'll kick off a new community planning process this summer. And if you take down this information, you can find our 2021 MHSA annual update. And that'll give you information, as Hillary mentioned, about all the various programs that we have. And we're looking really forward to having you all and others participate in our summer fall community planning process, and more announcements will come to that beginning soon. Next slide. And as far as program expansion planning, program expansion planning. So I mentioned CalAIM. So that stands for California Advancing and Innovating Medi-Cal. And that is a very large project. I strongly encourage you to look up CalAIM on your Google search. And there is a lot of information describing what that will be. The goal is to really integrate services, not only integrating, for instance, mental health and substance abuse as an integrated service versus separate, but also integrating medical needs, dental needs, public health all together, so that we're looking at a person in a very comprehensive way. I know folks use the term silo. The idea is really to broaden that all of our teams and agencies are working together to assist someone. And the new way that we could build Medi-Cal is going to change. So an example would be, it used to be someone has to have a serious mental health issue diagnosis to get services. Now they're actually giving time that someone could come in and receive services without a formal diagnosis initially. So again, that's really excellent to have the ability to do an assessment and to see what a person needs. Another example would be having more services available. So if someone has a difficulty with substance abuse or alcohol, instead of them potentially being arrested and going to jail, to be able to have a sobering station for them to go, and they would have a case manager go to that person and meet them and connect them to the next step, the resources. A medical example of that would be someone that may have needed skilled nursing facility after some type of injury, and yet they want to go home, but they can't go home because they need home support services, and that may not be available. Well, with CalAIM, home support services will be available, so that person can be able to go home and be in their own environment. I mean, it's actually more effective in every way, financially, emotionally. So that's just a couple of examples. I strongly encourage you to look at CalAIM's website. The kickoff is 2022, but this will go out 5 years as far as the processes of how the system is changing. And I believe very much for the better. I think it's something we all very much look forward to as far as seeing more services and integrated services. And so that there is no wrong door and no one will fall between the cracks, because we know that does happen. And so we're really looking forward to that. The other changes I mentioned as far as housing, MHSA and supporting that through the community support services and FSP. So MHSA is supporting some of those housing efforts, as I noted earlier. And some of the programs that Hillary mentioned, the Mentoring and Senior Homeless Innovation Project, that will be new again. And that came from the community's ideas. Basically, the community submitted those ideas to us, and the community then voted on which services they thought were the priority in the areas, and one of those was mobile mental health. So that was the #1 chosen area. And so again, another area that we need more support in. So innovations will be funding that. We're also in the very early stages and planning for various activities as new grants become available. I tell you, the team, those folks work really hard, sometimes have 30-day notice to get something in, and everyone's scrambling. And I see the work that folks are doing. I really respect that, how hard and diligent people work to ensure that we bring the dollars to our community. So more information on those type of activities will be forthcoming as we have more information and have more community listening input sessions. Next slide. A little bit about CalAIM. Some of the strategies about that is, again, overhauling how the Medi-Cal and the services that Medi-Cal can provide. So it'll have outpatient specialty mental health services. There'll be very much flexibility and reimbursement of services prior to diagnosis that I mentioned for both mental health and substance abuse, and a transition to whole person care program to enhance care management. I just attended a presentation. So whole person care of integrated services it's not going away. It's just going to be part of CalAIM. And again, adoption of new screening tools and instruments, simplified, streamlined documentation standards, combining both mental health and substance abuse, and of course, the payment reform. Very important. So there is a site there that, again, you can copy down that link. If you'd like a copy of this PowerPoint, it will be available on our website as well, so that you'll be able to have this information. Next slide. So basically, you're all part of our community partners, providers, and stakeholders. Everyone's voice matters. That's part of why we're meeting today. We're also, at some point in the future, would like to host some more community partner sharing, where we know there's an annual update where you can read about that, but it doesn't take the place of hearing people speak about that. So at some point, MHSA would like to host some of those and hear from you all that provide the services, and community members could come and ask questions, and also gives us an opportunity to how we could better refer to each other as well. So the more we know about each other, the better we could provide services to our community. Next slide. Okay, so we're going to begin questions and comments, and for those that might be watching this on video, there'll be you can email us questions and comments as well. Please go to the Wellness Everyday website and also MHSA at Ventura.org. Here's some information for you about how to get in touch with us in different ways. If you want to join our mailing list and receive everything we have, Suicide Prevention Council, MHSA community planning, just let us know what list you'd like to be on, and we will then, by all means, include you in everything that we send out. The Wellness Everyday is where you find a lot of resources and information, not only about what we discussed today, but about suicide prevention, other services that are available. It's a really great website that also has video recordings of folks sharing their stories. So again, please be sure, if you don't have time today to ask your questions or give us comments, you could do that by, if you could go back one slide. You could do that by going to MHSA at Ventura.org. But for those of us that we're going to stop the video recording right now, and we're going to open it up for questions and comments. I would ask if you could raise your hand. We'll start with people that want to ask questions live. And